Hi, Dr. Pelto here. I have a patient, she's wearing correct toes and I've adapted them to her foot. So I want to explain a little bit about what I did. She has a bunion, as you can see. She has a second hammer toe. And I adapted these in a couple ways. One is I removed part of it on the side so it doesn't push out her little toe. I trimmed it so it fits back in her foot, into the crevices here. And I also split it right here. And I'm going to explain that to you here, kind of what we did for her. So you can see she has a very elevated hammer toe. That's why we're doing this. And I put this little cut at the base because she likes to wear flip-flops, and so she's going to put her flip-flop in there when she wears her correct toes. Now, before she was doing this, for the last year or so, she's been using, this is called a Bunion splint, and this sits and it pulls the toe down. But a better option are going to be these correct toes, but these have to be done with like an anatomic shoe. This is an example of a Lems, kind of like the Lems that I'm wearing. And so we have these modifications that can be pretty easily done. You trim it here, trim it here, trim it here, and this will fit. And these last a number of years. So it's a good investment for patients that have had toes. I always say change the shoe first and then do the spacer to help pull the toe down and help correct everything.